Welcome to the Faith at Work podcast. Today we have Dr. Duncan Donald with us today, and you're going to have to help me on the full, because I know you've had a lot of job titles, but right now, Medical Director of Trauma at Forrest General Hospital.
Trauma Medical Director.
Okay, so
Director of Surgery.
So that's really intense. So we're so happy to have him today. He's also a small group leader in our youth group and the father of two of our students. So we know him very well. He's a great guy, and we're going to be blessed by this conversation. So you doing okay?
Doing well.
I know you're in the middle of everything that's going on nowadays, so everything I will probably get into a little bit, but
it's been a challenge for everybody, dealing with all the changes that have come about with the coronavirus. Right. So it's been a little different. I've learned to be a lot more flexible because things have been changing regularly, and the restrictions and easing of restrictions, and this is what we thought was best practice. Maybe this is best practice instead. So it's some adjustment, but it's worked out.
Well, good. And I'm sure we'll touch a little bit about it later. But just tell us a little bit about who you are. I know we were talking about with Jeremy before this. You're from Clarksdale, but
yeah, I grew up in North Mississippi, in a town of Clarksdale, in Mississippi Delta, North Mississippi Delta, and I actually grew up in the Methodist church there. It was kind of funny. I grew up going to a Episcopal school, and then went to the Methodist church. So I had a little bit of,
I know a little bit about that. Different denominations,
but I was kind of learned a little bit about Episcopalianism. While going to Episcopal school, we had regular chapel meetings and things like that, and then.
That's pretty interesting.
And then was able to, go to the Methodist church there, and then. And I was heavily involved with a great youth group. We had a great youth program in my church, and really enjoyed that, and got an excellent faith foundation. Now, then I went off to college, and when I went off to college, I didn't connect with a group in college. That's my advice is to kids who are going to college. Hey, stay connected with some type of faith group because it helps keep you a little more grounded and rooted. By not being connected, I didn't go to church very often, and I would say my faith kind of withered probably during those 4 years I was at college. It's just because I didn't make it a priority. I should have made it a priority. I didn't make it a priority. I wish I had. And then I ended up moving to Birmingham and worked for a year in a research lab at UAB. Interesting going to medical school, but didn't get into medical school my first time I applied, so I ended up working in Birmingham. And I started having an interest in, all right, I'm out of college, I'm an adult now, I gotta get my life together. So I wanted to try to find a good faith group in Birmingham, and I started exploring a bunch of different churches. And I guess I was searching for something that really spoke to me at that point in my life, and the problem I made, I wasn't able to commit to one church, and I started visiting a bunch of different churches, and I bet I went to probably, 12 or 15 different churches during that year in Birmingham. Just, go to one for a couple of weeks, and this is not exactly what I'm looking for. I'll go to another one, and I bounced around a lot, but I was yearning for getting that closeness to God. And then I went to medical school, and I got to medical school that following fall, and moved to Jackson. And the thing that helped me the most was getting in with the Christian Medical and Dental Society that was meeting regularly in Jackson. So you had a group of good friends that you were in school with that also helped give you some accountability, and that group proved to be extremely beneficial. There was a bunch of different people from different denominations, but we met regularly and were able to begin growing in some faith there in that part. And then I started residency, and then and then they kind of took it off the rails for a while, just because residency, they work you to death and work you a little more. So we were on call every third night in residency. So if you stop and think about it, every third night being on call in the hospital, that's 4 months out of the year you're spending the night in the hospital. Plus, the standard day was about a 12-hour day. Sometimes a little longer. So
that's crazy. My brother is an ER physician in Nashville, and he's told me stories. I mean, we've heard about his journey, and just hearing that from you too, it's wild. Just the general journey from elementary school to being a doctor, and like the amount of work and schooling and I mean between residency and just everything that comes with it is just
Well, fortunately, they've made some changes now to residency training programs where it's a little more restricted hours, and so that they do have the opportunity to kind of catch their breath in between. But
right.
this was the time before they had those duty hour restrictions, and it just physically just about did you in, emotionally sometimes too. But that's the point. I was able to get involved some with the Galway Methodist Church there in Jackson, but not real heavily involved because I was always working.
Right.
And when I wasn't working, I was generally sleeping.
Right.
Because you're exhausted all the time.
You.
Yeah. So, but that was the time that I got married to Tracy. That's when Lane was born, and then we moved to Hattiesburg. And fairly early on, we had visited a few different churches, and fairly early on got tapped in with Main Street, and got involved in a great Sunday school class here at Main Street. And I give all the credit to Chris Howishell, who decided he was going to start a young couples Sunday school class, and kind of directed that and ran that for a number of years. And that was a great group to be a part of.
I think we have like 3 or 4 people from y'all's Sunday school class that's on this podcast. We're going to be on this podcast, so you do have a great.
Well, this was probably 2000. Late 2003, 2004. I mean, this has been 15, 20 years ago, and this is, but that was a great way to get involved in, having that small group experience and having some opportunity. We went through the book of discipline and kind of learned about the Methodist history of the Methodist Church, and I had the opportunity to read some more challenging books that kind of, and some Bible studies that kind of help grow your faith during that process. So it's been an ongoing journey, so that that now at this point I feel like I'm still learning and trying. But that's what I would tell people: when you get in with a group of people that you can talk to and see regularly, and kind of get to know a little more intimately, more than what you can get maybe in a big church service. Then I think that's probably where you get the most growth. That's my perception.
Anyway. That's really good. So what? You touched on your faith journey a little bit. Now, what kind of drove you to be? What got you into the medical field? Like, what kind of influenced you or drove you to be a doctor? The why?
It wasn't my initial plan. When I went to college, I was going to study astrophysics and go work for NASA. That's what I wanted to be. I was going to go work for NASA, be an astrophysicist. And then I took physics and I made a C in college physics. I was like, this might not work out so well,
I've been
boy, it's a struggle. I love my astronomy classes, but my physics classes were just not great for me. So I was like, maybe I need to find something else to do. And I thought about doing medicine, and I went to medical school thinking I was going to do family medicine because I wanted to be able to treat a broad spectrum of disease, be able to see everything, all in between. And then when I did during medical school, you start doing, in your third year, you start doing rotations through different specialties. You have to do pediatrics and family medicine and OBGYN and psychiatry and surgery and internal medicine. Yeah. And so I was on my surgery rotation. I was like, this is kind of cool. I like this. This is, you get to actually do stuff. You do something and you operate on somebody and you fix them. It's like a mechanic. You go in there and you find the problem and you fix it and then put it back together. It's great. So I started enjoying that, and I decided to go into general surgery specifically for the opportunity to be able to treat everything from all ages, from a newborn with pyloric stenosis all the way to the 90-year-old who has collapsed lung or whatever, anything in between, and do any part of the body, from the cyst on the top of the scalp all the way to the ingrown toenail, head to toe, so to speak. And then I've kind of gravitated toward trauma surgery. I've noticed that over the time of being in medicine, I have really discovered that everybody, we see a broad spectrum at the hospital. That's all I sometimes tell Tracy and the girls that, there's a whole segment of the community that some people are isolated from that you may not see routinely. The people that you might not be aware of the homeless population around Hattiesburg. Well, eventually they come to the hospital. Or you might not be aware of the domestic violence problem in Hattiesburg, but eventually they come to the hospital. The child abuse problem in Hattiesburg, eventually they come to the hospital. So we see so many walks of life and so many broken people come to the hospital. I mean, not just medically broken, not physically broken, but also emotionally broken.
Right.
You see so much of that.
Yeah.
People with drug abuse problems, homelessness, domestic violence, you name it. All that eventually comes to the hospital, and it's here, it's in our community, and you don't think about it, you don't like to think about it,
Right.
most people don't really seek it out because it's not something pleasant, it's challenging, it's difficult, it's uncomfortable, so we don't look to go find that type of population, but it's here, and and you see it, and so, but the thing about it is when you see all these people that come to the emergency room or come to the hospital for their various problems, you can always find that there is some goodness in all of them. I mean, there is all of them are a child of God.
Yeah.
And when you look for that in people and you seek it out, you'll find it. It's there. It's there. And even the most, what historically you would think of as, this guy's a dirtbag, but if you start looking and talking to that person and investigating and talk to them, you can generally find that there is some goodness and some love and some holiness in every person.
I love that because I think it's very appropriate for times that we're experiencing, and every person, whether you think they're good or not, we're made in the image of God.
Yes.
And having that perspective, and that kind of leads me to my next question in regards to how your personal faith has kind of impacted your work. When you face those issues, whether it's a child who's been hurt, whether through abuse or otherwise, or domestic violence, or even just some person who's gotten real sick, who's maybe somebody that like, how has your personal faith influenced and impacted some of the worst situations that you've experienced as a doctor? That's a loaded question. Sorry, but
well, it's difficult. When you see brokenness, I guess nobody gets out of bed one morning and says, "Hey, I think I'll go be a drug addict. Hey, I think I'll be homeless today. I think I'll be, get in an argument with my family member and get shot."
Right, yeah.
Nobody plans on those types of things.
Yeah.
But they happen. Those things do happen. I think I'm going to go be in an abusive relationship. Nobody plans out those things. And it's always been kind of curious to me as to what circumstances led to this. And usually I found that by treating people with some respect and honesty and even sometimes just frankly asking them, "Hey, what happened here? How did this start out?" And you would be surprised at how much in common everybody has with what you would normally think of this other segment of society. Things that this guy was married, he had a family, he had a productive job, and then he had an injury, and then he got on some pain medicine, and then he got addicted to pain medicine, and then he wanted more and more pain medicine, became an addict, and then his wife and his children left him, and he lost his job, and now he's homeless, and it's just things that you can see how easy it is to fall into these traps. And when you see people like that, you try to reach out to them to recognize their humanity in them, and then try to comfort them and take care of their issue that they have, and then try to direct them toward a better life. Because nobody wants to be a drug addict. Nobody wants to be homeless. They don't want to be in those situations. And if you can try to show them some degree of compassion in a situation like that, it's very appreciated.
And so recognizing humanity, I love basic that. That's I don't know. I just feel that and I may be, hopefully I'm not off base here, or maybe I'm just not understanding of what doctors totally do, but I mean, it's definitely in the medical field more of a physical aspect.
Yeah.
Right. So
and you're also treating people when I'm treating people when they're generally at their most vulnerable. They come to me and they need surgery.
Right.
So they're gonna allow me to cut them open and muck around on their insides.
Right, yeah.
I mean, that takes a tremendous amount of trust in me for somebody, for that patient to bestow that permission to you, to give you that consent to say, okay, I trust you to slice me open and fix me and then put me back together.
Right.
That takes, it's a very physically intimate type of thing. And it takes a lot of responsibility. And so, there are some patients are not comfortable with it, but a lot of times I like to pray with my patients, particularly before we go to surgery. Hey, let's say a prayer. A lot of patients appreciate it and are craving that type of spiritual interaction, to acknowledge. And then we're seeing people, also, I hadn't really touched on it, we're seeing people who are at the end of life,
Mm-hmm.
that can be a
That was
real
gonna be my
difficult
next thing.
thing.
So if you want to, like, kind of.
That's a real challenging thing when you start to realize how fragile life is, and when you see these people who you can't fix. That's a real humbling experience when I've had all this education, I've had all this training, I've had all this effort put in, and you can't fix everybody. And that sometimes can be frustrating. But there are people who come to the hospital and they die. They want to die with dignity. And so when you can help them through that, and they can understand, their family's reaction when the family's obviously sometimes very distraught about what's going on or what's coming, or, if you can try to help prepare them for the understanding from a spiritual level that, hey, we're all children of God, and this is not a finality. This is not an ending. This is a transition. One analogy I've used with some people is like, imagine your loved one is leaving on a wonderful journey. They're getting to go, a trip around the world. Now, you won't see them again, but it's going to be a wonderful destination for them. So they get to go, and those type of things, that you could try to explain to them to help make them comfortable with the idea of letting go of a family member sometimes. Or even the patients, when a patient comes to me and has terminal cancer, it's real difficult to look them in the eye and say, I'm sorry, but this is a disease we're not going to cure, and you're probably going to die of cancer one day. But how can we help you and support you in making this transition? We know you got a battle ahead, and I'm here to be a guide along the way, so to speak. So try to give them to approach that sense of need with people, right, and try to help guide them and comfort them when everything seems to be very scary.
So I just love what I'm hearing, because I don't know what it shows me and tells me that, at least with your job specifically, because you're in surgery, and that can be such an intimate, vulnerable space for the patient and their family. Your job is not just medical, at least the way you view it, if that's fair to say.
Oh,
I mean, there may be others who are like, yes, you have this wrong with you, I'm going to fix you, but from what I'm hearing from you is, it's much more spiritually involved, or just as much as it would be physically when it comes to surgery.
Oh, absolutely. And it's not just all about, medicine and pills and things to try to, alleviate pain. It's also about comforting people and trying to alleviate their anxiety and explaining to them what's going on, or even, somebody who is unfamiliar with being in the hospital. They come in and maybe something routine. They need a hernia operation, or they need their appendix out, but they've never been to surgery before. They don't know what's going on. And now, for instance, like now we're in the middle of the COVID crisis. There hadn't been hospital visitors, so there's been that too. So you could be like all alone, and they're here all alone. They don't understand what's going on. What are you doing? What are you going to do? What I expect? Where am I going? What's this going to be like? Yeah. And sometimes it's we had to step back and go, all right, this is the first time this poor soul has been through anything like this. Let me stop and try to explain the process to them and give them some comfort, to explain to them what's happening, what's going to happen, what's coming for them, just to try to, is that fear of the unknown for a lot of people. But having that spiritual piece of it for people who are going to be going through something uncomfortable, physically uncomfortable, to try to bring that spiritual piece of it to alleviate their anxiety can oftentimes be just as therapeutic as writing a prescription for pain medicine.
Was there a certain point in your career and faith journey where, at what point did you start to realize like this is much more than just medicine? You know, and was there a certain moment, was there a certain patient that you had encountered where you're like, you know, they're needing more than just me doing the surgery. They need some comfort, they need some support. Like, was there any kind of instance in your journey that like that just showed up, or was it gradual? You know, does that make sense? What I'm asking?
Yeah, it was gradual. The one that sticks out the most, and there's been numerous examples of patients along the way, is I had a patient when I was actually in residency. I was a chief resident at Jackson at University, and there was a man that came in to the emergency room that had stomach pain, and we ended up diagnosing him with a gastric mass that looked like a gastric cancer. And so I was a chief resident. My first thought was, all right, I get a gastric cancer case. I don't get to see many of these. It's going to be a great case. I get to do a great operation. It's going to be fun. We'll go and take out part of it. So we had the opportunity to sit down with this gentleman and his wife and talk about, you know, what was going on and, you know, what we were planning on doing and explain to them the nature of the operation. And so the next day I was all excited. You know, jumped out of bed to get to work to go do this gastric cancer case. It was going to be great. You know, I was focused really on the science of it.
Right.
And we ended up taking the surgery and did a great operation. Everything went real smoothly. And then about 3 days after surgery, he started getting sick and wasn't doing very well. He was still in the hospital, and then I could see his wife was very concerned. Well, he got worse. We had to take him back to surgery. He had some complications, had to do some bowel resection. He ended up getting sepsis, had to go to the ICU. His wife came to see him in ICU and, of course, was very distraught. And then I realized that, hey, this is a tremendous responsibility that we are taking on because it's not just the science here. These are people's lives. And she started telling me all about his history. He had been a big Alcorn supporter. He was a huge Alcorn fan, and how much he started telling me all about his life and how he'd gone to Alcorn. He was the first one in his family had gone to college, and you know his kids are coming by the ICU and he's dying. I can't stop it. It's just terrible.
I can't even imagine.
So he ended up passing away, and it was a real wake up call for me that you know these are not just patients, these are not just cases, these are not just science. This is, you know, humanity behind these people. So.
Well, so how, and you've touched on it throughout every story pretty much, but how has your personal faith, how has your relationship with Christ helped you and impacted you in your career journey? Because, I mean, it's not even just the patients, but it's the time away from your family, or it's when you're in residency and working a lot and not getting much rest. I mean, there's so many different dynamics that you've gone through in your journey, in your life that I've heard so far. How has your faith and your relationship with Christ kind of pushed you and helped you and impacted you and all that?
Well, it's been a journey, and it's been some difficulty sometimes, but it's
another loaded question. I'm sorry.
Well, when you find the opportunity to acknowledge someone's spirit and get to know them and their family on a personal level. I have a patient who came to the hospital with some lung problems, and he had a long history of smoking. He had some previous lung surgery that was like many years before for lung cancer, and it had some complications with that. It was done by another surgeon elsewhere. And anyway, and he came to see me, and he was having some lung issues we were having to deal with, and ultimately he needed some surgery. And you know, by this time I'm seeing him regularly, getting to know his wife a little better, and then we ended up having to operate on him, and it turns out he's got a recurrent lung cancer. And he ended up going to ICU and had a lot of problems after his surgery, and he was in the hospital for about 6 weeks, and eventually he passed away. But I'm seeing his wife every day, and you know, seeing his extended family members. His brother comes to the hospital, his children come to the hospital who are grown, and kind of getting to know them and hearing the stories about him. And you know, sometimes you get angry because you want what you want. You know, sometimes you get angry with God. And you're like, Why does this have to happen? Come on, Don. Why can't you save this man? This is not fair. And you get frustrated. And then his wife told me, she said, you look tired. You look worn out. And I said, well, I don't know what else to do. I've been trying to save your husband. I don't know what else to do. And she said, don't worry. This is not for your concern. This is not for you to worry about. She said that I've been praying for you and your family. Sorry.
Okay.
And I want you to know that God's going to take care of you and He's going to take care of us. And so don't worry about this. And she gave me a card I carried with me because she said, you look worn out and haggard. She said, I want you to keep this. It's a wallet card. And it has Isaiah 40, verse 31 on here. But they that wait upon the Lord shall renew their strength. They shall mount up with wings as eagles. They shall run and not grow weary. So it's a great verse to think about. What we're doing is not just a daily job. It actually is impacting people's lives, and that we can use that opportunity to use our faith and to try to be more Christ-like in what we're doing for others, and realize that sometimes what patience can bring to the conversation can make an impact on you as well.
So that's powerful. That's really powerful. Well,
so she gave me this card. I still carry it. I had it for, I don't know, more than 10 years.
Wow.
So it's just
that's awesome.
something that I carry with me just because it made such an impact on me. And you have all kinds of cases like that where you have people who make an impact on you. Patients who come to you and you end up running into them at Walmart. There's one lady I took care of for some thyroid problems, and I still see her from time to time around town. I'll run into her once every 6 months, and it's kind of funny because she always calls me her knight in shining armor. And she'll be like, "There's my knight. I'll see her around Hattiesburg from time to time. So those kind of things are encouraging, and you get the reward, I guess, of not only having treated them scientifically, but get to treat them spiritually as well. And sometimes multiple members of the same family. You take care of someone and then they bring their mother in to see you, or somebody that, I took care of a young lady one time at the hospital for a long time, and her parents were there, and I saw their parents almost every day, regularly saw them. And then after we got her better, then her father started to come see me. And I knew him already because I've been seeing him in the waiting room, just about every day. And then, a year or so later, he ended up having terrible cancer and he passed away. And then a year or so later, his wife came to see me for some unrelated issues with a mammogram. So, it's just kind of funny how you start taking care of multiple generations of people and get the opportunity to get to know people and get to make a connection with them, because, it's not just the interaction of daily work. Hey, how you doing? Right. You actually, some of the deepest connections I made with patients were patients who were having complications. The ones who do great and come in and have their appendix out and go home in a day or two, you don't get to know them as well. The ones who come in and they have a problem and they're there in the hospital for 6 weeks or 2 months, or come to see you for 6 months to a year or 2 years in the office. You're seeing them regularly and you get to know them much better. Unfortunately, that sounds kind of
I get it.
unfortunate, but.
Well, I can't believe we're already up on our time pretty bad. I could listen to you all day, I think, and I'm just so grateful for your honesty and your vulnerability and your openness, and thank you for your work. It's grateful, or I'm so glad to know of the doctors in my family, namely my brother, and knowing you, and knowing that there are physicians out there who understand that it's not just, physically getting somebody better, but it's getting to know that person, getting to know their spirit, like you mentioned, and knowing that there is a holistic, I guess is the word would be for, approach to meeting your patients and their families, and all the work that you guys do. So I'm so grateful for y'all. I love you, and our ministry loves you because of your presence, both with Lane and Sydney, as well as just as a small group leader. But we thank you so much for your time, and we may have you on again because that went up quick, and I've listened to you for a long time. So we thank you so much for being here.
Thank you for having me. Appreciate it.
Well, thank you very much, and please be on the lookout for more episodes. We have some incredible guests that will be joining us. I don't know if they're going to top Dr. Donald, but please be on the lookout for that, and we're so glad that you joined us as well. Thanks.
Thank you.